Before preparing the infusion, first verify the healthcare provider's orders indicate the type of solution, the amount to be administered, and the rate of flow or time over which the infusion is to be completed. Prior to venipuncture, consider how long the patient is likely to have the IV, the kind of fluids to be infused, and medications the patient will be receiving or is likely to receive intravenously. These factors may affect choice of vein and catheter size. Review the patient record regarding previous venipuncture and patient allergies. Note any difficulties encountered and how they were resolved. All of the supplies you may need are here at the station, and extras are underneath the table. Take a moment to look over and prepare your equipment. In preparation, review the healthcare provider's orders and patient's MAR and plan of care. Review record for patient allergies, especially latex products and betadine. Make sure the patient's clothing or gown can be removed over the IV apparatus if necessary. Some facilities provide special gowns. Review instructions for using the IV catheter because a variety of needle safety devices are manufactured. Introduce yourself to the patient.
Good afternoon, sir. My name is Milton and I'll be your nurse today.
Verify the patient's identity using 2 unique identifiers.
Sir, can you tell me your name and date of birth?
Explain what you are going to do, why it is necessary, and how the patient can participate. Explain that venipuncture can cause discomfort for a few seconds, but there should be no ongoing pain after insertion. If possible, explain how long the IV will need to remain in place and how it will be used. Discuss how the results will be used in planning further care treatments.
Sir, your physician has ordered an IV.
Perform hand hygiene. Assist the patient to a comfortable position, either sitting or lying. Expose the limb to be used, but provide patient privacy. Select the venipuncture site. Use the non-dominant arm if not contraindicated by mastectomy, fistula, or graft. The best veins are relatively straight and springy to palpation, but may not be seen. Avoid sites of flexion if possible. Remove hair with clippers, but do not shave the venipuncture area. Place a towel or Chuck's pad under the extremity to be used to protect the patient from blood and other spills. It may help to place the patient's arm in a dependent position, that is, lower than the heart, to help dilate the vein. Tear some extra pieces of tape if desired. Apply the tourniquet above the venipuncture site. Older adults with fragile skin may not require a tourniquet. Massaging or stroking the vein in the direction of blood flow may help it to dilate, as will having the patient clench and unclench their fist. Also, lightly tap the vein to distend it. Don clean gloves. Clean the area to be used, as shown, for a minimum of 30 seconds using a back and forth scrubbing motion. Allow the site to air dry completely before insertion of the catheter. Follow local hospital protocols. Remove the catheter assembly from its sterile packaging and inspect the needle tip for any burrs or irregularities. Use the non-dominant hand to pull the skin taut below the entry site. This stabilizes the vein and can also make initial tissue penetration less painful. Holding the over-the-needle catheter at a 15 to 30 degree angle with the needle bevel up, insert the catheter through the skin into the vein. A sudden lack of resistance is felt as the needle enters the vein. Use a slow, steady insertion technique and avoid jabbing or stabbing motions. Once blood appears in the lumen or clear flashback chamber, lower the angle of the catheter until it is almost parallel with the skin and advance the needle and catheter at approximately a half to 1 centimeter farther. If no blood is observed and you do not feel the catheter enter the vein, pull back on the entire catheter apparatus without exiting the skin. Reassess vein position, then reattempt venipuncture. If you are not successful, remove the catheter and look for a different site. Remember, the catheter is now contaminated and cannot be used again. Most facilities allow the nurse to attempt 2 venipunctures. If unsuccessful, the nurse must notify another professional to attempt venipuncture. Be aware that reinserting the needle into the catheter or rethreading the catheter onto the needle can result in damaging the catheter or breaking a piece off, which is likely to end up in pulmonary circulation. Holding the assembly steady, advance the catheter until the hub is at the venipuncture site. Stabilize the hub with thumb and index finger of the non-dominant hand. Put pressure on the vein proximal to the catheter with a finger to eliminate or reduce blood oozing out of the catheter. Attach the blood drawing apparatus and obtain samples. Dispose of sharps appropriately. Secure the saline lock and flush the IV to ensure patency. Watch for signs of infiltration or extravasation, evidenced by significant pain, edema, swelling, or coolness to the vein just distal to the insertion site. Do not allow any blood to remain in the catheter, as it could clot and render the IV unusable. Secure the catheter according to the manufacturer's instructions and facility policy. Secure extra tubing with tape as needed. Label the dressing with the date and time of insertion, type, gauge, and length of catheter used, and your initials. Discard of any disposable supplies, remaining sharps, or biohazardous material as needed.
Remove and dispose of gloves. Perform hand hygiene. When you've completed the procedure or you're departing the room, ensure that the bed rails are elevated, the bed is in the low position, the patient is comfortable, and the call button is within reach. Ensure you've documented the IV appropriately and accurately. Make sure you note the response to therapy or any complications during the procedure. A sample documentation follows.